Proper Moving Techniques by Bill Hyde and Jennifer Garcia. A few good rules. Always have several partners if possible to help lift or move a patient. When moving a patient, try to move in sync by counting or some other method. Move anything that may block the path of travel to help prevent injuries. Make sure the stretcher and or table is locked in place before moving a patient. Always assess your patient before doing anything. Always maintain good communication with your patient and your coworkers. And have the patient cross their arms before moving to help reduce surface area, which lowers the friction. Next, we're going to talk about proper body mechanics. Do not lift while bending forward, backward, or rotating your body. Maintain your center of gravity, which is at the pelvis. Try to keep your back straight and your feet approximately 4 to 8 inches apart. Position your patient at the level of your waist. Do not lift with your back. Tighten your abdominal muscles when lifting. Exhale when pulling or lifting. Stop when you feel discomfort and reassess the situation. In this segment, we are going to cover the air mattress. Whenever you're going to move a patient with the air mattress, what you need to do is secure the air hose to the air mattress. It will only fit in one way, so make sure it fits correctly. Before moving the patient to another bed or table, you want to take the straps seen here and secure them so that the patient does not roll or fall off of the air mattress during inflation. Once you have properly secured the straps, you want to take the excess end and throw it over the patient, or at least move it out of the way so it does not get snagged and cause a possible injury. You want to make sure that the straps aren't too tight over the patient. Next, you are going to inform your patient that there's going to be a sudden loud noise and that the mattress is going to inflate. You want to inform them of this so that way they do not become frightened and start to flail and possibly cause injury to themselves or anyone else. Once you've got the patient in the proper position, you want to turn off the air mattress and make sure that it is fully deflated before doing anything else. Ahahahaha! Apparently something was funny. The air mattress is just one of the many features that is used to help assist in lateral shifting of patients because it reduces friction and allows for easier movement of larger people. In this segment, we are going to cover the upper lip. You are going to take the sling and put it underneath the patient. You're going to need some help for someone to help lift the patient, so that way you may slide it underneath and get it properly adjusted. Now remember, when doing any of these things, you always want to inform your patient what exactly you're doing and why. Once you have the sling properly positioned, next you are going to bring in the upper lift and secure the straps to the machine so that way you can lift the patient and move them to where you need them to be. Before you go lifting the patient, make sure you inform them that they're going to be lifted into the air and that they may feel very high up off the ground, but ensure them that everything's going to be okay, that they will not fall. If at all possible, have the patient grab the bars in front of them to help them feel more secure and less panicky. Whenever possible, try to minimize the amount of travel that you have to do to get the patient from the chair to the bed or table. This patient had claimed that she could not move her arms or legs, and yet she is doing so. Nevertheless, make sure you maintain proper body mechanics and techniques when moving patients from one area to the next. Before you lower the patient down, make sure you notify them that you're going to do so. This way they don't freak out thinking that they are going to fall. Before moving the patient back to the chair, make sure you notify them that you're doing so. Make sure you let them know that you are rehooking them up to the machine that lifted them up in the air and is going to set them down in their chair. Once again, make sure you notify the patient that you are going to lift them in the air. This way they do not panic and cause any further injury to themselves or medical professionals around them. When lifting the patient, make sure that you pull down on a lever to make sure that they are sitting upright before doing it too late, like this gentleman here, and cause yourself any further back injuries. Whenever moving the patient on the upper lift, make sure that you move the machine nice and slow so that it does not tip over and cause further injury to yourself or the patient. Whenever you go to move the patient back to their chair, make sure that you guide them down to the chair to make sure that they are properly aligned and do not sit down on something that could cause pain to their back or any other part of their body. Before you bring in the machine to hook up to the patient, make sure that you adjust the legs down at the bottom to be wider or narrower. This way you do not incur any kind of possible injury from hitting obstacles. The upper lift is another one of the mechanisms used to assist in shifting or moving of patients. This one is mainly used for getting patients up out of chairs to put them on stretchers or tables for exams. Next, we are going to cover the Z-slider. Make sure you maintain proper patient communication and let them know whatever it is you're going to do, like lower their head or drop the rail, or put something underneath them to assist you in moving them from one area to the next. Before inputting the Z-slider underneath the patient, what you're going to do is untuck the sheet and put it between the bed and the sheet that they are currently laying on. Roll the patient up and stuff one side of the Z-slider underneath the patient, and then roll them back flat on their back. Once you and your helper are ready, you're going to roll the patient up again and pull the Z-slider out from the other side so that it is all the way underneath the patient to help reduce friction and assist in movement. If using a table mat, make sure you stuff in between the table and the stretcher to make sure that it does not slide or move out of place when moving the patient. The Z-slider is another form of a lateral movement. This is another method of a lateral shift with the Z-slider without using a table pad. In this section, we're going to cover the slide board. Much like the Z-slider, you're going to roll the patient up to put the board underneath the patient to assist in lateral movement. While doing so, you may want to move the tube out of the way so you don't knock yourself out on the floor and have to cause yourself to have an x-ray. Once you have the patient properly positioned on the slide board, you are going to shift them over from one area to the next. Slide board is another lateral shifter that uses less friction and makes it a lot easier to move patients. Next is the table pad. Just like in a segment with the Z-slider, you're going to stuff the table pad in between the patient's bed and the table that you're going to transfer them to. This is to ensure that the table pad does not move while moving the patient. Before moving the patient over from the stretcher to the table, make sure that the bed is properly adjusted so that way it is not too low or too high when transferring the patient. Either one of these could cause further injury to the patient, and that we do not want. Whenever laterally shifting a patient, make sure you have them press their arms if they can, as this reduces surface area as well as friction. If you ever want to go down in the history books as a bad medical professional, this is the way. Whoa! Glad that wasn't me. Always make sure that you got both sides covered. Make sure you always use proper body mechanics whenever moving patients, otherwise you could end up with a back injury or possibly other injuries as well. Ooh, that looks painful. Really glad I'm not that guy.
I'm sexy and I know it. Ay.